India, a vast and diverse nation, is home to over 1.43 billion people from various cultural backgrounds. Genetic research provides valuable insights into the origins and causes of various diseases and disorders. The human genome, composed of approximately 20,000 functional genes, serves as the blueprint for producing all proteins. Genetic disorders can arise from mutations in single or multiple genes, interactions between genetic factors, and environmental influences or chromosomal damage. These inherited conditions pose significant health challenges, especially in regions with prevalent consanguineous marriages and limited access to health care. Given India's growing burden of genetic diseases, the Government of India, through Department of Biotechnology, has launched an initiative called Unique Methods in Management and Treatment of Inherited Disorders, UMMID, to tackle inherited genetic diseases. By leveraging cutting-edge scientific technology, UMMID seeks to prevent and treat inherited genetic disorders, ushering in a new era of precision medicine in India.
At the Department of Biotechnology, our aim, since conceptualizing the UMMID initiative, is clear, that is to bridge the gap between complex genetic research and direct patient care. Through UMMID, we have integrated genetic screening, diagnosis, and training for clinicians directly under one umbrella. The success of our pilot phase proves the power of targeted public health interventions. Now expanding nationwide, UMMID marks a vital step towards a future of preventive genetic healthcare.
DBT UMMID initiative shifts the focus of healthcare from top-down to early detection in the first trimester, especially for maternal health. This program aims for cost-effective interventions related to thalassemia and hemoglobinopathies and includes a risk assessment form to reduce morbidity rates. The UMMID initiative is a distinctive effort to address the burden of genetic disorders in the country through establishment of three components complementing each other: Nidan Kendras, outreach to aspirational districts, and training centers for capacity building. The Nidan Kendras have been set up to enable individuals from remote areas to access top-notch medical services all in one place. This excellent initiative has helped to make screening and diagnosis of common as well as rare genetic disorders accessible to even the poorest sections of society. The second UMMID component, outreach to aspirational districts for antenatal and newborn screening program, is primarily focused on conducting screening for potentially treatable conditions in newborns and pregnant women. Counseling is also provided for a potential untreatable condition, offering the choice of either carrying the pregnancy to term or opting for prenatal testing and management. The third component of the program are the training centers that are involved in providing training to the in-service clinicians working in government hospitals and medical colleges. Since its pilot launch in 2020, the 5 Nidan Kendras have provided screening services to more than 60,000 individuals and identified genetic abnormalities in over 13,500 cases, providing invaluable data for appropriate management of their conditions. The outreach centers have provided screening to more than 130,000 pregnant women and 77,000 newborn babies in 9 aspirational districts. This has resulted in prevention of more than 40 hemoglobinopathy-affected births and early diagnosis of more than 200 babies with various treatable genetic disorders. More than 60 faculties from government hospitals have been trained. Pan-India expansion of UMMID will cover 22 states and union territories through establishment of around 70 UMMID components with the target screening of more than 6 lakh individuals in the next 3 years.
With the establishment of the Nidan Kendra project, not only have we been able to provide comprehensive clinical care to our patients, we are also now able to provide comprehensive training to all our students.
We had established around 14 mutations in thalassemia ANC patients, as well as we are doing the prenatal diagnosis also for the couples.
And in the preventive aspect, we are able to counsel the patients to undergo genetic diagnostics to prevent a nurture of a genetically abnormal child. So every day there is an academic schedule which brings us even more closer to understand genetics.
The program has been instrumental in setting up of the infrastructure, generating resources, and strengthening capacity building in government setups for combating the burden of genetic disorders in the country.
Through the UMMID initiative, Department of Biotechnology is building a nationwide ecosystem for early diagnosis, genetic counseling, and management of inherited disorders. By strengthening Nidan Kendras and promoting newborn prenatal screening, UMMID is bringing affordable genomics healthcare closer to families across India. This model program also reflects India's commitment to integrating advanced genomics with public health delivery, ensuring equitable access to precision healthcare, and reducing the long-term burden of rare and inherited diseases.
The department envisages to create a strong ecosystem that will be the foundation for enabling a national screening program for genetic disorders to reduce disease burden of rare disorders to 50% for Viksit Bharat 2047.
As we all know, a healthy and a developed India can only be built when every child gets timely health care and the opportunity to lead a healthy life. And to that extent, the UMMID program of the Department of Biotechnology is a significant step towards this vision. Through this flagship initiative inspired by Prime Minister Narendra Modi, facilities for newborn screening, for genetic diagnosis, and for counseling are being strengthened across the country to support families affected by inherited and rare genetic disorders. By combining science, innovation, and public health, the UMMID program is indeed helping in early detection and timely intervention, thereby reducing the burden of disease and improving the lives of thousands of children and families across the country. And therefore, UMMID has turned into a real UMMID, reflecting the government's commitment to affordable health care, to scientific advancement, and to the vision of Viksit Bharat. I sincerely appreciate the efforts of all the doctors, the scientists, the healthcare professionals, and the institutions contributing to this important national mission.